Did you know that some common medications can increase your risk of developing dementia and other cognitive problems? That's right. Although these medications are often prescribed to treat important health problems, their prolonged or inappropriate use can affect brain function, especially in older people. Before we talk about medications, it is important to understand what dementia is. Dementia is not a specific disease, but a term that describes a range of symptoms associated with a decline in brain function. These include memory loss, confusion, difficulty making decisions, and language and communication problems. The most common type of dementia is Alzheimer's, but there are other types, such as vascular dementia and dementia with Lewy bodies. Dementia usually occurs in older people, but taking certain medications can increase the risk or speed up the development of these problems, especially when used for long periods. So let's get to know the 7 most worrying medications. Drug number 1, benzodiazepines. Benzodiazepines such as diazepam, Valium, alprazolam, Frontal, and clonazepam, Rivotril, are often prescribed to treat conditions such as anxiety, insomnia, and seizures. However, studies show that long-term use of benzodiazepines may increase the risk of dementia. These medications act on the brain to induce a calming effect, but over time, they can interfere with cognitive and memory functions. How does this affect the brain? Benzodiazepines alter the functioning of neurotransmitters in the brain, which are essential for communication between nerve cells. Prolonged use can decrease brain activity and impair the formation of new memories. What to do? If you use benzodiazepines, it is important to talk to your doctor about alternatives or gradually reducing your dose. Never stop using these medications suddenly, as this may cause withdrawal symptoms. Medication number 2, anticholinergics. Anticholinergic medications are used to treat a variety of conditions, including depression, allergies, urinary incontinence, and Parkinson's disease. Common examples include diphenhydramine, Benadryl, oxybutynin, ditropan, and amitriptyline, triptanol. These medications block the action of acetylcholine, a neurotransmitter crucial for memory and learning. Acetylcholine is responsible for communication between neurons and, when blocked, can impair cognitive functioning. How does this affect the brain? Acetylcholine is essential for processing information in the brain. Blocking this neurotransmitter can cause memory problems and mental confusion, especially in the elderly. What to do? If you are taking an anticholinergic medication, ask your doctor if there are options that are less specific to cognition. In many cases, it may be possible to adjust the dose or change the medication. Medication number 3, tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline, triptanol, imipramine, tofranil, and nortriptyline, Pamelor, are a class of medications used primarily to treat depression and anxiety disorders. Although they are effective, these medications have a strong anticholinergic effect, which means they can affect cognitive function, especially in older people. Like anticholinergics, tricyclic antidepressants block the action of acetylcholine, causing problems with memory, concentration, and mental confusion. Talk to your doctor about the risks and benefits of continuing these medications, especially if you already have memory problems. There are more modern antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, which may be a safer alternative. Medication number 4, antipsychotics. Antipsychotics are medications prescribed to treat conditions such as schizophrenia, bipolar, and psychotic disorders. Medications such as haloperidol, Haldol, and risperidone, Risperdal, are used to control symptoms such as delusions, hallucinations, and aggressive behaviors. However, these medications have also been linked to an increased risk of dementia, especially in elderly patients. Antipsychotics alter levels of dopamine and other neurotransmitters in the brain. In older people, long-term use can accelerate cognitive decline and increase the risk of dementia. If you or a loved one is using antipsychotics, especially in older age, it is critical that use be closely monitored by a doctor. These medications should be used in the lowest dose possible and for a limited time. Medicine number 5, sedatives and hypnotics. Sedatives and hypnotics are widely used to treat insomnia and other sleep disorders. Medications such as zolpidem, Stilnox, isoprene, Lunesta, and zaleplone, Sonata help people sleep, but with prolonged use, they can cause addiction and damage brain functions, including memory and learning. Like benzodiazepines, these medications act on neurotransmitters that inhibit brain activity. Over time, the brain adapts, and the result can be a reduction in cognitive abilities. If you rely on sedatives to sleep, ask your doctor about alternative strategies for treating insomnia, such as cognitive behavioral therapy or relaxation techniques. Sleeping medications should be used cautiously and for short periods. Medication number 6, anticonvulsants. Anticonvulsants such as phenytoin, hidantal, valproate, depakote, and carbamazepine, Tegretol, are used to treat epilepsy and other seizure-related conditions. These medications are also prescribed for the treatment of neuropathic pain and mood disorders. However, prolonged use of anticonvulsants can impact brain function, affecting memory and increasing the risk of mental confusion. Anticonvulsants affect electrical activity in the brain, which is critical for processing information and forming memories. At high doses or with prolonged use, this can lead to cognitive decline. If you are taking anticonvulsants, maintain regular follow-up with your neurologist to monitor for side effects. Dosage adjustments or replacement of other medications may be necessary. Medicine number 7, antihypertensives. Some antihypertensives, such as beta blockers, e.g. propranolol, and diuretics, e.g. furosemide, used to control high blood pressure, have also been linked to cognitive problems, especially in older people. Uncontrolled blood pressure itself is a risk factor for dementia, but certain medications reduce blood flow to the brain, impairing memory and cognitive function. Reduced blood flow to the brain can cause ischemia, a condition in which parts of the brain do not receive enough oxygen. This can lead to the death of neurons and the development of dementia-like symptoms. If you are taking medications to control your blood pressure, it is essential to monitor their side effects. Talk to your doctor about medication adjustments or safer options to avoid long-term cognitive problems. Although many of the medications listed are essential for treating serious conditions, it is essential to be aware of their side effects on the brain, especially when used for long periods or in high doses. Long-term use can increase the risk of cognitive decline, memory problems, and, in some cases, dementia. However, this does not mean that you should stop taking these medications without medical advice. In many cases, there are safer alternatives or ways to reduce the risks, such as adjusting the dosage or finding complementary treatments. The most important thing is to maintain an open dialogue with your doctor. If you notice any changes in memory, confusion, or other signs of cognitive decline, discuss your concerns and ask about possible medication adjustments. Together with your doctor, you can find a balance between treating your health conditions and protecting your brain. Additionally, remember that healthy habits, such as a balanced diet, regular exercise, and staying mentally active, are also important for preserving brain health and reducing the long-term risk of dementia. Now that you know the 7 medications that may be linked to the development of dementia, it's time to take action to protect your mental health. Talk to your doctor about your medications, watch for signs of cognitive decline, and adopt habits that promote brain health And of course, share this information with friends and family who can benefit from this knowledge. If you like this video, don't forget to like, subscribe to the channel. Until next time, bye.